I would like to introduce you to Josefa Enriquez, who is the chair of the session, and welcome Elisabetta Aurino, will be presented by Josefa. Thank you.
Hi, everyone. Thanks for coming. And thanks, Elisabetta, for your time and for the presentation that will follow. Elisabetta is an assistant professor of economics at the University of Barcelona, and her research has focused on child and youth development in low and middle income countries. So in that topic is that we will be diving in today in this great presentation that's going to come forward about texting parents to support their children's education, experimental evidence from Ghana. As Francesco said, if you have any question, let us know through the chat. We will be monitoring the chat and also our other channels. If there's anything pressing, we will let Elisabetta know. The floor is all yours, Elisabetta. Thank you again for accepting our invitation.
Thank you so much, Josefa, and thanks so much, Francesco, for inviting me. I'm very excited to present you this ongoing work to you, and I look forward to your questions and feedback. So this is joint work with my colleague Sharon Wolf, who is based at the University of Pennsylvania. She's a developmental psychologist, and as you will see, I changed a little bit the title of the paper because there is no such a thing like a deadline or a seminar to really go back to a paper and work on it. And we've been working quite a bit in the past weeks, and we decided that actually this new title fits better the message we want to send with this paper. So we will talk about the unequal consequences of messaging parents for child education in Ghana. So I appreciate mostly of you are a health crowd. So I just wanted to before we kind of dive into the nitty-gritty of the paper, I would like to just draw your attention on what is called the global learning crisis in the kind of global education policy and researchers group. So across the 90s and the 2000s, countries in Sub-Saharan Africa, Asia, and Latin America really pushed hard to get kids into school. And in fact, in the 2000s, there has been an unprecedented number of children that started, that finally reached the educational system. And for instance, to give you an example, in Sub-Saharan Africa, from the 90s to the 2000s, we had a massive increase in the number of kids that are in primary school, moving from 50 to 80%. But as the data started to come in, people started to realize that actually kids, despite the fact that they are in school and they tend to complete primary education, they actually don't learn very much in these educational systems. This is the new data that just came out last year from the World Bank, UNICEF, and UNESCO. And the orange line is the global share of kids that at the end of primary school, so after 5 or 6 years of school, cannot read a simple sentence like "the sun is hot" at the end of primary school. And so this is around 50% in 2019, and of course the pandemic, as everywhere in the world, exacerbated learning problems and inequalities therein. For instance, for groups that are more vulnerable to poor learning, like low socioeconomic status, or in case of some countries, girls. And you can see that Africa, Sub-Saharan Africa, this proportion is actually higher. And the latest simulations show that 90% of kids at the end of primary school cannot really learn something very basic that the school system should deliver. So given this sad awareness of this fact, a few years ago, a group of Nobel Prizes and really recognized experts in education came together in a panel, this Global Education Advisory Panel, and they started to rank, based on the evidence base, interventions in education that could really support learning to really address this global learning crisis. And they actually took instruments from health economics, because they started to look at cost effectiveness, because we also need to remember that a lot of these countries are really fiscally constrained to invest in education. So they started to rank interventions by based on the evidence, the existing evidence, and their cost. And actually, the only the intervention that was considered the most cost-effective to improve learning in low and middle-income country settings was really messaging strategies. So sending messages to parents, teachers, or students themselves about the benefits, costs, and quality of education. However, when we were looking at the actual evidence that that exists out there related to these messaging strategies, actually there is quite strong evidence in high-income countries of the effectiveness of these strategies, and there is some evidence in middle-income countries like Chile, Brazil, and so on. But actually, there is very little that we know whether this work in lower literacy rural context and during crisis. So as we will talk about later, this project was actually during the COVID pandemic. And out of the 10 studies we identified from low and middle income contexts, only 3 out of 10 were conducted in sub-Saharan Africa. And actually the populations that made up the sample for these studies were actually pretty advantaged compared to the average of, for instance, rural population. Other literature gaps were heterogeneity of these approaches by child, gender, and household background, so socioeconomic status, and also we don't really know why these approaches work, because mechanisms were not really investigated. So basically, this is what this paper sets out to do. Basically, we adapt a program that was already that had been already tested in Brazil and in Cote d'Ivoire, and it seemed to be working there to support parental educational engagement. And we adapted to the context of rural northern Ghana. So this is a very subsistence farming context, similar to many other countries in the Sahel, very dry, very rural, and pretty deprived during the pandemic. And basically, we sent out to parents messages to support their engagement with their kids' education. So we sent them suggestions of activities and information to get closer to their children's school lives. And these activities are non-curricular, because many of these parents, as we will see, are not did not go to school themselves. So it's mostly like things that can do with their kids. We also modified this program by trying to emphasize for half of the parents the relevance of girls' education, because this is a context in which there are quite large inequalities by gender in schooling. And this was during the pandemic, in which there were a lot of worries about the unequal consequences of the crisis in terms of girls' education. And then basically we test these 2 versions of the program through a large-scale trial, household randomized trial, in 5 regions of this northern Ghana setting, whereby we have 2,600 households, and we sampled 2 kids per household, also to look at issues related to age and gender within the household. So why we focus on parental educational engagement? Well, there is like a vast evidence about the importance of parents' engagement in education and in general in child development to support academic progress and skills, okay, both cognitive skills and social emotional skills. And This is why parental educational engagement is actually a pillar of any educational system globally. So each educational system tries to, in some way, foster the engagement of parents into kids' school lives. However, this is often limited, especially among lower RCS parents, and this is true both in high and low income context. And to give an example, in the settings we worked, this is from another study that look at similar context, only 13% of parents had conducted any stimulating activity with their young kids or any play in the previous 3 days. And also based on our own work from other projects in Ghana, when we talk to teachers, they're always complaining that parents don't really engage in their children's education. So this is something that is kind of, there is a demand for improving this engagement. However, this kind of low engagement clashes with the very high educational aspirations that parents have for their kids. So for instance, in our own sample, this is, as I said, it's a very rural sample, but basically 80% of parents aspire for their child to reach at least a bachelor degree, and many parents actually aspire to master and or graduate education. So every parent in the world, like most parents in the world, actually have very high educational aspiration, and especially in this context of poverty, they really value education as a key way to overcome poverty in the long run. So why is this the case? Why there is this low engagement on the one hand and these highest aspirations on the other? Well, of course, there are barriers that are related to resources, like time or actually money to support their children's education through, for instance, buying books or tuition and so on. But on the other hand, these kind of resource gaps have been addressed by a vast literature in development economics that tries to provide cash, food, or other things like uniforms and books to support child education. But then there is the recognition quite recently that actually there may be also behavioral biases at play. Because education is a key intertemporal decision in which we parents have high costs at the moment, but actually the returns from the investments in their children's education are potential and may realize in the future. And so the program tried to tackle 3 identified behavioral barriers for limited engagement, parental engagement in education. One is the story of salience, that when you are in a context of poverty, money-related thoughts may kind of overcome other investments, okay? So in a sense, there may be limited salience of education when poverty limits cognitive bandwidth. And this may be particularly important for this evaluation because we worked during COVID, and so poverty stressors were actually even more salient than in usual times. The second barrier is that parents are often, so these kids are often first generation learners. And so parents may actually don't know what to do to really support their children's education. And in fact, this is a study from Peru, but it shows that actually schools really give out little guidance in this sense to parents. And there is, and even from our kind of anecdotal evidence in Ghana, we saw that there is a lot of divide between parents and teachers, okay? They don't really communicate a lot. And the third is gender bias. This may be particularly high in rural areas where the returns from investing in girls' education may be perceived as lower, and there may be a lot of skewed gender norms that may affect the investments themselves. So again, these barriers may be larger for lower educated parents and exacerbated by major crises. And in fact, previous evidence show that nudges that kind of try to overcome some of these barriers for education actually increase parental engagement and child academic progress in both high and middle income countries. So the research questions for our study is whether these SMS nudges, so this very low touch intervention, can increase parental engagement in education and improve children's school enrollment and attendance in this very rural and low literacy setting during the pandemic. So actually, when we set out to do this study, this was really at the beginning of the pandemic. And our original design was that we would have a group of parents that received the messages during the school closures, and then as school reopened, another group of parents would continue received. So we wanted to check whether the program would vary, its effectiveness would vary during school closures and afterwards, but actually we had massive delays. So basically, we started the program as all the kids went back to school. Then the second research question is whether the nudges are actually effective in promoting our kind of secondary outcomes that are learning and social emotional skills. And then we look at the heterogeneity by parental schooling and by child gender and age. And then we try to understand what could be the potential mechanisms for these, for any effects. So I will just give you a little bit a preview of the results. So on average, there is no effect, okay? So even if we look at child reports or parent reports, there is no effects of the program on our primary outcomes. So engagement, the blue lines, enrollment, and attendance, okay? So nothing. And then we started, so we had, we set out our analysis in a pre-analysis plan in which we anticipated some heterogeneity by the axis I mentioned earlier. And basically, we don't find any heterogeneity by whether the parent is a man or a woman, or whether the child is a boy or a girl, or their age. But actually, we find very diverging effects by parent literacy rates. So basically, for parents that have no formal education, which actually is pretty high. We didn't expect it was so high in this sample. We had 66% of parents that have never went to school in their life. The program actually had negative effects. So across engagement and especially around attendance. For enrollment, most kids are in school, even in this very rural sample, 90% of kids went back to school after COVID. Whilst if the parents had some schooling, and in this case, I'm talking about very low level of schooling, whether they ever attend some years of primary, for most parents, the program actually seemed to be working in the way that we theorized. So it had a positive, like working towards positive effects. Okay, so we find this large heterogeneity. This is based on the children reports, but we find very similar effects if we use the parent reports. The same divergence is regards to skills. So with parents, we know for the kids whose parents had no schooling at all, no formal schooling at all, we don't find any effect. But with the parents that had some schooling, actually we find improvements in social emotional skills. And this is really consistent with the kind of theory of change of the intervention that was related to really getting parents and children closer by talking more, doing activities together. So this may have a positive effect on the social emotional skills. And also for the kind of standard treatment, we also find some signals of positive effects for literacy. So what are the potential mechanisms at play? Well, we examine difference, but probably one important mechanism that we think may be at play is a reduction in self-efficacy, especially among parents with no schooling. So the fact that they received these messages for them may have signified it was a kind of a signal of, they thought that we had some qualitative data that I will discuss later, but for some parents, it seemed that they received the messages because they were not good enough, okay? So it was sort of a signal of not doing their job well enough, which was really counter to our intention, which was really to give them tools to empower them to support their kids better. So there is this reduction in this parental self-efficacy with regards to education, so the parents' perception of supporting or being able to support their children's education. And for the parents with some schooling, there is an increase in stress. So by receiving the nudges, they felt kind of more compelled or doing more for their child education. So with regards to the contribution to the literature, we contribute to different strands of research. One is the first probably is the one related to these policies and programs to support education in low and middle income countries. So this is a very vast literature, as you can imagine, but as I mentioned you before, most of it has actually focused on resources. So given like cash transfers or resources to kids to go to school, like uniforms, but there is more limited evidence on these behavioral programs. And basically, we actually, so in the past year, there are other studies that were actually conducted during the pandemic as well, kind of using these behavioral tools, because these are very very cost effective and also easy to deploy during emergency. So this is why there are a lot of studies coming out. And basically they're increasingly, so this is from Bangladesh and this is from Brazil, and they're showing that actually these behavioral programs may increase the inequalities. So our study kind of is consistent with this mounting evidence base. And we also contribute in terms of mechanism. This is another that was conducted in El Salvador during the pandemic, and it also showed these counteracting effects of the nudges and also these increases in stress. So basically, one key takeaway perhaps is that targeting is key. So these approaches in very low literacy settings work for some people, and you really need to target them well. Otherwise, you are increasing inequalities and parental stress in times in which you don't want to increase more parental stress. And then we also contribute to the broader nudges literature, in which basically, because we also varied experimentally the length of exposure to these nudges. And basically what we see is that the effects in either direction, whether they're kind of positive or negative, arise early. So we had a midline, and we saw that they were already, after 3 months, they were already arising, and they stick. So after 6 months that the program ended for some households, we see that these are persistent. And this is an important finding for the nudges literature, because usually nudges are thought to be effective in the short term, but less is known about their kind of midterm effectiveness. And also previous evidence, especially from Latin America, has shown that actually you would need very high frequency messages to change behaviors. But what we find is that actually our messages were bi-weekly, that even a low frequency program is enough to change behaviors. Unfortunately for some households, this was in a negative way. And these backfiring effects that are actually increasingly shown by the literature on nudges. And also we contribute to other literatures about parental beliefs and behaviors and gender equality in education. So before I go forward, are there any questions?
Not so far.
Okay, great. So I'll move to the context. So we work in Ghana, which is a very nice setting for this research question, because Ghana is a country that was actually one of the most successful countries in Africa in relation to enrollment. So most primary enrollment is universal, and actually they have very high rates of preschool enrollments, which is a compulsory in Ghana, and now they also made compulsory junior secondary school. So they are one of the pioneers of getting kids into school at different levels. But despite that, we have learning in general. So similar to the rates we saw at the beginning of the presentation, and there are wide inequalities. These are mostly for kids of lower socioeconomic status households, and especially kids in these northern regions. And this is why we decided to set our study there, because when the pandemic hit, we were having discussion with the Ministry of Education, and they were particularly worried around that area. Ghana is also quite, and so this kind of picture of low learning and wide inequality is quite consistent with many other countries in sub-Saharan Africa and beyond. Also, as many other countries in Africa, schools close for a very long time. Okay, so in Ghana, they closed for almost an academic year. And again, this kind of, there were a lot of worries about the consequences of this very long school closure in the backdrop of these very low learning levels. And our baseline data, which we gathered in December 2020, so after basically 1 year of school closures, we saw that basically only 20% of the kids at baseline were at least doing something related to education for at least 2 hours a day. And in general, only some of the parents helped with the homework. So this kind of, there were this worry that what would happen to education for these kids due to this limited engagement. And in fact, it seems that the learning disparities by gender and poverty exacerbated. Okay, so this is why it's an interesting context, because it's quite similar to what happened in many other countries in sub-Saharan Africa. And there was a lot of increase in poverty and in food security. So our program was designed by an educational startup in Brazil, MOVA, and basically it was already tested. This is why we decided when the crisis hit, we started to think, so that was March 2020, we started to think about a potential intervention. And so this was already there and tested by Sharon and Guilherme Lickland in Côte d'Ivoire and in Brazil. Okay, so there was this intervention that was pretty already there and pretty easy to deploy, right? Given text, the SMS, and also given that in Ghana there are very high coverage rates of mobile phone penetration. So basically, the program was designed based on another study that was done in the US originally, sending out to parents 2 SMS per week with information and suggestion of activities to do with the kids to support their learning. No academic knowledge was needed. Let's see. Oh, no. Sorry, the link maybe it doesn't work. But the contents related to, first of all, we started the week before schools reopened. So we started to say, well, hi, the schools are reopening, just make sure to re-enroll your child. And then there were contents related to time use, because we know that especially girls do a lot of household chores. So kind of making sure that kids have enough time to study, or things like talk with your child about your day, ask about their days as well, talking about educational plans, aspirations, and so on. So things that really didn't need much of an academic knowledge. And it's quite cost effective, right? This is SMS. There are basically zero marginal cost, and these costs include our time and the time of MOVA to kind of adapt it to the context of Ghana. So we worked with local NGOs to really made it adapt it to the specific problems of this area. And also we designed this additional gender boost arm that try to make more salient the issues of girls' education. And as I mentioned you before, we had different arms with different program lengths. So just to give you an example, so basically one sequence was sent across 2 weeks. So in the first week, basically parents gather messages about with a bit of information. So this sequence was about time use. And so the first is about the importance of making time for kids to study. And then this first message is followed by a suggestion of an activity, in this case, kind of splitting chores and time to study so that kids have enough time to study. And then in the second week, basically there is an interactivity message where basically try to kind of reflect on what could be something in a way to kind of reach that goal. And then there is a growth message that closes the sentence about kind of reinforcing the main idea. So this is kind of the general program. Oh, sorry, I saw there is a Q&A. Oh, sorry.
Yes, don't worry. I'm collecting them. Yeah.
Okay, wonderful. Sorry, I didn't realize. So this is kind of the standard program, and this is the gender boost arm that basically sends out the same kind of contents, but more related to the daughters. Okay. So making daughters more salient in parents' mind. So in terms of design, so we sampled around 2,600 households in these 5 regions of North Ghana. We recruited by phone because we were in the kind of height of the pandemic, so it wasn't possible to do in-person data collection. And basically we sampled from 2 existing studies. So one that was concluded, the Communication for Development, and the other, this is kind of an ongoing study, the Ghana Panel Survey. And basically we called households, asking them if they wanted to be part of the study, asking consent for the kids and themselves. And basically we sampled randomly 2 kids per household in 2 age groups, 5 to 9 and 10 to 17, because we really wanted to see whether the program would work differently based on whether the child was kind of in the younger group or in the kind of adolescent group. So basically we then randomized these households to 5 treatment arms, a control, and then these 4 treatments. So 2 arms related to the standard program, varying lengths, so ranging between 3 months and 6 months, and then the gender boost program ranging between 12 weeks, 3 months, or 6 months. At the beginning, when we thought about the design, we were thinking to do everything by phone, like all the different surveys, but then we realized that that was not optimal, so we decided to then move to in-person data collection, and we had an end line in August, September 2021, in which we basically tracked most households. We had very little attrition, and we don't find evidence of selective attrition, except from being in 2 regions, which probably were the most remote. But anyway, we restrict, so all the analysis that you see today are based on the sample of the panel household, okay, to remove concerns related to attrition. So, well, this is the timeline. Well, we had this baseline kind of enrollment call. Then we started the implementation just before the schools reopened after these 10 months of closures. Then for the group of 3 months, we ended the implementation in April, 1st of April 2021. Then we had a midline, but I won't talk about it today. And then we ended the implementation in June for the second batch of households that got the longer treatment. And then we had this endline survey in August and September 2021. Just a word about the fact that this period actually was not only challenging because of the pandemic, but also there were other things that happened, a lot of flooding in these areas. There was Ramadan, so it was a complicated time for these households. Okay, so the randomization was pretty successful in getting similar groups. And just to give you a little bit of some characteristics of the household, so you kind of have a gist of how the sample looked like. So these are pretty large households. In general, we have around 10 people living in the household. The caregivers are around 44, around in their mid-40s. And you can see that very low literacy, like formal schooling rates. Households had on average 3 kids in the school age, school age years. And you can see there are very, very high aspiration, but skew with differences between daughters and sons. Okay, so this is a place where gender inequalities in general and gender bias is pretty extensive. In terms of measures, as I mentioned, we didn't think that this very low touch intervention could change skills. So our primary measures were parental engagement. So we wanted the parents, we thought that intervention could help the parents to be more involved in activities related to education. And this parental engagement scale is based on a module by UNICEF that runs these MIX surveys. And basically it asks about whether the parents had played or had talked to the child or went to the market or did activities with the kids, okay? And these were the activities were age specific, and then we thought that probably the intervention could support enrollment and attendance. Okay, and for both of these primary outcomes, we measured both parent and child because we were worried about some reporting biases. So we wanted to see whether things were in line between parents and kids. And we also, at the beginning, we also set out to collect data on schooling from the schools. And we had massive problems in getting the authorization. And we're actually, after 2 years, we are finalizing the data collection for that, which is actually quite nice. So we can see across almost 3 years of school. So I hope this will be good data that we can incorporate in this analysis. In terms of secondary data, we also more distal outcomes. Let's say we look at child literacy, math, and social emotional skills. In this case, we had direct assessment with the children themselves, and these were age-appropriate assessments. And then we looked at different mechanisms, self-efficacy, distress, aspiration, expectation, and pro-boy bias. Because of course, for the gender arm, we hoped that could kind of attenuate biases. Most scales, except for enrollment and attendance, are aggregated using maximum likelihood, and basically we standardize over the control using mean and standard deviation. Okay, so most are standardized scores. And for the empirical strategy, this kind of standard given is our RCT. We have the outcome for the parent or the child living in household age at time t. We only focus at endline. And basically, we look at whether the household was assigned to the standard programs versus the gender boost program, and then whether the sample was from one of the 2 studies I mentioned you earlier, For some households, we have problems with we started a bit later, the implementation, so we control for that. And then we have region fixed effects. Okay, and the errors, the standard errors are clustered at the caregiver level. So let's just move to the results. As I mentioned you before, either with regards to our primary outcome, engagement, enrollment, and whether this is a dummy, whether the kids is attending most of the time or every day in the previous week, we don't find any effect, okay? Neither treatment and neither whether we look at parents' reports or child reports. And basically, this lack of variation or effectiveness is reflected whether we look at caregiver gender, child age, and gender. So there is no variation around that. And duration, we can talk about that later if we have time. But we find, as I mentioned you before, we found this large heterogeneity by parents' schooling, okay? And this is true whether we look at, so it's quite consistent by whether we look at parents' reports and child reports, okay? So this is the interaction between the two programs, whether the parents had some formal schooling. And you can see that especially for engagement, but also across the other measures, depending in some cases on the program, but still we find that the program seemed to be kind of working in the desired direction if the parents had some formal school, okay? And as I mentioned, this is not very high levels of education. So these are parents that at most have a completed primary, okay? Whereas with the parents with no schooling, actually the program seemed to be going in the opposite direction. And this is the graph we showed today that kind of plots the coefficients, and you can see this divergence, okay? Then we find, in terms of main effects, when we look at secondary distal outcomes, we see that actually the gender boost arm seems to be increasing social emotional skills. This is kind of marginally significant. But actually this increase is mostly driven by kids whose parents have some education, okay? So this is quite a large increase in social emotional skills for large difference, okay? Okay, so this we saw at the beginning of the presentation. Again, it shows you these kind of diverging effects in terms of skills. And basically, when we start to think about this divergence, we can think about different reasons why we have this divergence. So the first thing is really looking at descriptive statistics. In which ways these parents are different? Well, parents that have some schooling are less likely to be males, are younger, have a little bit less kids to take care of, and actually they have lower expected returns from education, and are also have less bias. So these are all baseline characteristics, right? Also less pro-boy bias. With regards to implementation, there isn't a lot of difference in terms of parental schooling. So in terms of getting the SMS from broker reports or receiving the SMS, parents with some schooling are slightly more likely to receive or report receiving the SMS. Of course, the one major difference is if they were able to read, okay? And so parents that had some schooling were much more able to read, and that makes sense. In fact, at the beginning of when we were thinking about this project, we discussed a lot about whether doing audio messages or text messages. And based on the Côte d'Ivoire study, actually, in which they tested both audio and text, actually they didn't find any difference in effectiveness there. So we said, okay, well, if they work similarly, texts are much cheaper, and they're much more nimble. So if there are changes over time, like let's say the schools close again, we can kind of change contents very fast, while for audio you need to get somebody to record again. So that's why we decided to do text. But actually then in the hindsight, the Côte d'Ivoire sample was much more literate. So it was 70% of literacy. So that's why probably we didn't expect such low literacy rates. So probably this is something we learned if we do this in the future. But in terms of remembering, so parents were asked if they could talk about the contents. And so we created this variable related to whether they remember stuff from the messages. Actually, parents with some schooling remembered better. So they had people that read for them and remember more stuff, which is interesting. And they kind of report of applying the contents and still applying the contents at the end of the evaluation at similar rates. So it's not a clear story about implementation, being able to use the contents. Another thing that we were wondering was whether education was something that was proxying something else. Okay, so education, we know it's a very commonly used proxy for wealth or socioeconomic status, or it could be a proxy for ability to make decisions within the households and empowerment, for instance, in case of women caregivers, or it could be a proxy for preferences for child development investments. Okay, so in additional analysis, we started this is the parental the outcome is parental engagement, and we started to add these interactions of being part of the treatment and proxies for these different things like SCS, decision making, and child development. And you can see that actually the interaction between the nudge and having some schooling is remarkable. It decreases a bit when we add all the set of interaction, but actually it's pretty consistent across model. So it seems actually this is something to do with human capital of the parents themselves rather than other things that education may be proxying. And with regards to mechanism, so this is so I mentioned you before at the beginning of the presentation, these negative effects on self-efficacy and on distress. So this is for all parents. We also find that there is an increase. So by making daughters more salient, actually there is an increase in gender bias, which was counter to really what we were hoping for. And for aspiration, there is a decrease in aspiration, which actually is not reflected in expectations. So how much they expect their kids to complete. This is not necessarily a bad thing. Maybe their aspiration is they were very, very high at the beginning of the evaluation, so they're becoming a bit less, perhaps unrealistic. But yeah, we find this very counterintuitive based on what we initially thought on effects on these mechanisms. Okay, and then before I close, I would like to just draw your attention to we did some qualitative work afterwards with parents that received the program, and basically we had in-depth interviews and focus groups with 30 parents, and basically we have 3 takeaways. The first one is that the parents really felt inadequate to enact on the messages. So as you can see here, they were talking very frequently about the fact that since they were not educated themselves, they didn't have a lot to say in terms of supporting their kids' education. And this may be really explaining this divergence that we saw. And then this idea that the messages acted as a signal of them not being able to be good enough, which is, yeah, very, very sad. So in this quote, it says, "I believe I received the messages because they knew I was not doing enough." So this is something that this kind of, if we want to take forward this idea of messaging, really, we need to rethink how to engage parents and really make them understand that this is not because they're not good enough, it's just to support them more, okay? And this is something that is important if given these messages, approaches are really in the interest of donors and policymakers alike. The second thing is that actually, when they were talking about how the program made them feel, there was a kind of this dichotomy of emotions. So basically, parents said it was stressful, but also interesting at the same time. Or it made, like, this is again related to the self-efficacy story, it made me feel like I have not been supporting well, but also it motivated and encouraged me. So there is this kind of dichotomy of feelings with regards to the program. And the other interesting thing was that they felt that the messages were just a temporary intervention that would end, and they didn't see the sustainability in this. And so this is another important thing to think of when you think about policies, okay? So I don't know how am I going with time. Maybe we leave a little bit of time for messages, for discussion.
Yeah, sure. I think if you could work with 3 minutes.
Yeah, I can just yeah. So for what I would like to stress is basically, one thing is that the messages may make more salient the lack of formal schooling, some parents said. And this is kind of consistent with this idea of social identities or stereotype threat, that when your identity in a group is made more salient, you actually, if you are in a disadvantaged group, you may actually do worse, okay? Also, the fact that these messages came during a time of stress may actually have increased more the stress that they were feeling. And also this idea that these messages are not enough, at least for the parents with the no formal schooling. And we need to think about the idea of how to if we want to use this more, how to kind of complement with other activities or support. And so basically, just to summarize, so this very light touch program can improve parental engagement in child outcomes in a very deprived sample for parents that have some limited human capital, okay? So that they can have this human capital to enact on the messages. Otherwise, nudges can backfire and actually exacerbate educational inequality. So basically, this kind of heterogeneity underscores the potential of this very low-cost program if well targeted. Otherwise, it could be even worse. And yeah, so maybe we can have questions or suggestions.
Thank you so much. Yes, thank you so much. We virtually applaud you. A very interesting presentation. So I'm going to start with some that I have received. How generalizable is your study, and how much accessibility to the technology impacts the private areas in essence? I suppose I'm trying to read through and summarize, but I suppose that your nudging depends on actually the ability to have some minimum technology access, so SMS and so on, right? So I guess that this question, which is a bit scattered, means that the more the area is deprived, the less likely you might have access to those technologies. So there is a technological bias potentially. You want to comment on that?
Yeah.
If it's something
sure.
that affects your results, or that you might consider in generalizing your policy implications? I guess that's where it's going.
Yeah, no, that's a very great question. In general, mobile phone are really prevalent, even in these very deprived areas. So this was a sample that was enrolled based on whether they had a phone, because we called them. The enrollment was by phone. So it was a selected sample in a way, but mobile phone penetration in Ghana is more than 100%, meaning that people have even 2 or 3 SIMs. So at least like most households have a phone. these are not smartphones. These are really kind of basic kind of Nokia phone, but they do have it. So that's why there is a lot of potential for this kind of low-tech solutions, because people in general everywhere have a phone.
Okay. Now, what was the language used in the SMS nudge, or was it just a pictorial nudge? And another question is, what was the phone ownership in the parents with no schooling?
Okay, so the language is another thing that we thought a lot about. So they were in English, and because this is kind of the common language in Ghana. So we had, especially in the north, there are a lot of different ethnicities that have their own kind of languages, like more than 200 ethnicities and so on. So we thought to do in English, but in general, people use English at school, and it's the kind of, yeah, the common language. The question was about the phone ownership. Everyone had a phone.
Was it pictorial? No, you said the language. Sorry.
No, it was really kind of old school text.
Yes, and the other one was what was the phone ownership in the parents with no schooling? They
did have at least a phone in the household, because otherwise they couldn't be part of the program.
I see.
What we kind of miss out, and now in the insight, you know, when you do finish a study, you think, why didn't I ask that? We didn't really ask a lot about kind of access to the phone, like by mothers. So I in many cases it was the head of the household owning the phone, which was in many cases the man, could be even a grandfather. So we should have asked more to understand, like, how accessible were the messages to, like, the primary caregiver. But yeah, so they needed to have a phone to be part of the study.
Okay. Given some of the results that you have presented, might the intervention have actually caused deterrence in parents' activity?
Yeah, it seems, unfortunately, yes, it seems like. So for some parents, they decrease their engagement. So
I guess the I don't know, it's always hard. I mean, some are good, some are a bit difficult, but this one is more. So can you measure that actually, or you can't, because you might have also lag times and things like that, or not?
The what?
You might have also delay, you know. I mean, it's in the reaction. I mean, maybe the exposure time might also be a factor there. There is ambiguity in your results, I guess. So that might be. I don't know. I'm trying to give. It's your study. I was trying to imagine that maybe some of those results are time dependent or exposure time dependent.
Yeah. No, so I actually show it, but we look at so since we had this difference in exposure by time. So for some households we had 3 months, and for some other we had 6 months. And we tested whether there was differences in exposure by time, and actually there is not. So even for the 3 months, actually what we see is that the effects kick immediately. So at midline, which I didn't show today, but after 3 months of the program, we had a midline, and the effects were already there in this diverging way. And then they stayed, because for the parents that had the 3 months program, when they were interviewed in August, September, that was already 6 months were already passed, and we saw they were persisting. So something we want to see is whether actually this persistence is there in the administrative data that we are collecting.
Okay. Very good. Did the study also look at the school retention of children, maybe for a year or another time frame, depending on the study duration, that got enrolled after the study intervention?
Yeah, that's that's what we are really curious to see. So the fact that for getting access to administrative data, it took us 2 years. The kind of silver lining is that we can look at across the different school years. So whether they enrolled later or they keep being in school or not. So this is something we are actually completing data collection today. So yeah. I will keep you posted.
Thank you. All right, this one is the question, probably the last one, and also that I had about your effectiveness measure. I suppose I'll add my bit as well to it. Can you define effectiveness? In fact, here, you know, it's I guess when it comes to education, it's a little bit complicated, right? Because it might be intrinsically or per se a positive, but it's not 100% the case. For example, life outcomes may depend on millions of other outcomes, millions of other factors. So, and then the second part to that question, given that you say that it's cost effective, what's the actual value, monetary value, if you had a go at it?
So the cost-effective bit is, I don't say it, is the global advisory panel that say that this is the most cost-effective thing you can do for education to improve learning globally, okay? And we are kind of critical to that because the evidence that they based on to reach this conclusion actually is kind of skewed because it comes from better off samples, and we show that actually in a poor sample things can go pretty wrong. Okay, so it is of course cost effective, and is in the sense that the marginal cost, once you have the program, imagine that this worked well, okay, and it was actually improving educational outcomes. This is like super cheap, right? Like if the government of Ghana sends SMS, especially for health stuff, all the time already. So this is something that you could scale pretty easily at a very low cost. So in this sense, it's pretty cost effective. Then we could argue how measure effectiveness in education. I guess we could define the outcomes. Oh, sorry. My battery is dying. We could define the outcomes, whether learning kind of standard deviation or so on. So there is a lot of debate around how to measure effectiveness of intervention in education. Usually it's about learning standard deviation, but yeah.
Okay,
it's
that's interesting. Let us know what further stuff you will do. I'm interested in this part. I suppose that we are way over time, so we don't want to disrupt any further Elisabetta's day. I have some more from the live streamers, so I'll forward some. I'll screen them for you. I'll forward them and see whether you can provide an answer, and then I'll put them up online. So I wish to thank Elisabetta and Josefa for also organizing this and for being with us. Elisabetta, we appreciate it a lot. Good luck for everything. I hope to see you in person very soon, and thank you for all of you who came on Zoom and on live stream YouTube and LinkedIn. Please follow us in our live stream events on our website, Value Economics and Policy Group. We are branching out with Elisabetta, and we are wishing to do that more in areas that intimately correlate with health, such as education, of course. So please come forward, even if you have topics or papers you want to present. Yeah, have a great day. Thank you, Elisabetta.
Thank you so much for staying until late. I appreciate it, and thanks for the invitation.
Thank you. Bye-bye.